Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts. This one comes in from Reddit, comes with a picture, which we will show you. And the question is, found on back, 36-year-old female after popping what they thought was a blackhead, not itchy about the size of a dime. Well, like I always say, and this is particularly pertinent to you, your best bet is getting to see a local board-certified dermatologist who can evaluate you in the flesh. If you're in the New York City area, you can come see the doc. I'll be happy to help you. But if you're not, I'm sure you can find a wonderful board-certified dermatologist wherever it is that you are. So this thing falls into the new growth category. So any new growth that you're not sure about that just like pops up on your skin is like, you must get in to see a dermatologist. Now that being said, in the context of what you're describing, so it sounds like you were kind of like traumatizing the skin and you're getting a blackhead out, or maybe it was a cyst or something analogous, and then you develop this like red, weepy looking lesion in that same exact site that you were manipulating, traumatically or mechanically. So sometimes what can happen is you can get something called a pyogenic granuloma. So it's like sort of like wound healing tissue that just goes like overboard and just can't really kind of resolve itself. So you just get this like, growth essentially, which is what you have there. Now there are other things that could be actually bad things that can look similar. So typically what's done is you get in to see your dermatologist, we remove it, and then we just submit what we remove for pathology, just to make sure it is this thing called a pyogenic granuloma, and to exclude any other possibilities that could potentially be more dangerous. So it behooves you to get in to see a board-certified dermatologist who can evaluate you and like basically just remove that lesion that you have. It'll be both diagnostic and therapeutic. So hopefully the diagnosis will be a benign diagnosis, the one I just discussed. But any non-benign diagnosis needs to be excluded by a board-certified dermatopathologist. I do that as well. And just the simple act of removing it, if it's a pyogenic granuloma, in most cases is curative. So get in to see a dermatologist. Like I said, if you're in the New York City area, give us a buzz. But if you're not, I'm sure you can find someone great wherever it is that you are. I hope that answers your question. Let's get